Dr. Morse, recording is started.
All right, everybody. So, is everybody as frustrated as I am? It's been a interesting couple of weeks. I know it's been stressful. I hope those of you that had break last week were able to get some rest. Gonna do my best here to share my screen. Hopefully you will all be able to see it. I'll give it a second just to make sure it catches up. All right. Like I said, we do a lot to cover because there's been a lot of updates and changes. So I did copy and paste these these updates into the chat box just so you have the links right now. I just used DHD10, no favoritism to my other health departments. I know some of you are on the line. Just because it was there, I just copied and pasted them. These documents should all be on the Central Michigan District Health Department and the Mid-Michigan District Health Department website as well. But they're all the same. I didn't want to have to give you, 12 sets of links. So these have all the new guidances changed within them. We're going to go through all of it today. The other thing I'm going to review at the end is just the decision-making tool that I had made in the fall, early winter, kind of help make decisions about whether in-person or remote education is the best. So we're just going to review that at the end, but just to remind you that that is there as well. It's kind of buried down, further down in the list of documents, but just as a reminder. So we've been getting questions from you and from even some public members about the legislative act that requires the 20 hours of face-to-face learning to be eligible for the COVID dollars. I've asked the state about that, and if there's anything we can do about it, there really isn't. It is a legislative act, and public health really can't do anything about that. They did share, the Michigan Department of Education put out a memo that did have some helpful FAQs. You are likely aware of that and have likely received that, but that was the extent of the information that they provided me when I asked them if there was anything we could do about it. So that's all that I could find out on that. So on Monday, it was announced to us as well as to you. So we all found out together on Monday that the quarantine went back to the 14 days, which again, that's always been the recommendation from the CDC. It's just they gave us permission to go down to 10 days if we chose to. We knew that was likely coming. We just weren't sure when. But there has been so much spread, and particularly so much of the variant spreading, and it is so much more contagious. And we really are seeing cases that are developing at day 11, 12, 13, that again, we knew this was probably going to happen. We were trying to encourage 14-day quarantines in an area that we knew had a lot of variant. It's really difficult when people know that 10 days is an option, and so you get a lot of arguing. So hopefully this will make it easier for everyone that it's just a standard 14 days now. Again, our quarantine documents and all the other documents have been updated. The state has updated their FAQ. I was just contacted before this meeting and told that some of the documentation that was sent out from the state contact tracing group still said 10 days on it. Of course, when we were notified, we were told all of that would be changed. So unfortunately, it sounds like some things are still a little bit behind in terms of getting updated. So I'm going to make contact with the state contact tracers just to let them know. We have people that are still receiving instructions that still say 10 days. So we apologize for that. It obviously takes some time to get everything all correct. Another thing that changed, this is not hugely critical, but previously all the recommendations for travel were the same if you were vaccinated. They've now said that if you're fully vaccinated, the recommendation to get tested and quarantine after travel is no longer applicable. And for international travel, you still do have to get tested to return back into the United States. But the recommendation to get tested 3 to 5 days after you get back into the US and then quarantine does not have to be followed. And again, that's if you're fully vaccinated, which means you're 2 or more weeks past your final dose in a COVID vaccine series. And again, there's no requirement for quarantine after any travel. There are recommendations for self-quarantine. And as we'll go over data, realistically, for domestic travel, the worst place to be right now is Michigan. So, you know, I guess just keep that in mind. Another thing, and I think I even saw a question in the chat box already about this. In terms of the rapid antigen testing program, there is a handy algorithm on how to handle those results. It actually is a handout for all the different programs using rapid antigen testing, but the one for non-residential community settings, which as you can see is for schools, athletics, etc., is on this document. It's called the MDHHS Antigen Test Frequently Asked Question and Resource document. It's in pretty much every section of that website, but I have the links here. It's on page 8. So when you're doing your asymptomatic screening, someone who's not had any close contacts at all, you do their antigen test. If it is positive, they go into isolation and they go and get a PCR test right away. It has to be within 48 hours for this algorithm to work. Only if that is positive do you then initiate contact tracing. It is not a confirmed test until you have that positive. The reason why is that this is a very low risk situation, so the risks of a false positive with this antigen test is quite high. If you have someone who is symptomatic, or if you have someone who has been in contact with somebody with COVID, if the antigen test is positive, you do not need to confirm it with a PCR. They go home, they isolate, and you start contact tracing right away. There is some verbiage in a couple other documents that contradict this a little bit. They say they still should get a PCR test. I'm talking to the state about that, and they're working to clarify that. But this algorithm is, again, it's really helpful. I'm going to click the page here. This is the algorithm from the CDC. This is meant more for healthcare providers to follow, but just to point out, it tells you the same exact thing. So again, if you have on the right side here, someone with no symptoms, no exposures, the antigen test is positive. NAT testing is just the fancy abbreviation. It's nucleic acid amplification test. It's just a fancy catch-all term for a PCR test. So again, no risks. Got a positive antigen test, you need to confirm it. Only then, if it's positive, are they considered infected? Only once you determine that they are infected do you go on and do contact tracing. So again, this is just much more detailed. This top link here is the classic CDC 4,000 screens worth of text explaining all of this. So that's kind of the end all be all, but you know, again, it just kind of goes through that same thing that was on the previous screen, just showing you that this is really what is recommended. If they're symptomatic, positive antigen test, they're infected. Asymptomatic and close contact, what the fine print says here is in instances with higher pretest probabilities, such as high incidence of infection in the community like we have, clinical discretion should be determined, et cetera, et cetera. So basically in our areas, if you have someone who's been exposed and they have a positive, just consider them a positive. So again, this gets a little more complicated than the previous one because it is meant for healthcare providers and we don't expect you to do that much consideration. A little explanation on this. So, we've had a lot of comments from community members and some even from school administrators and things openly arguing with the sports testing protocol. Later on, I'll talk about the number of outbreaks due to sports, but I just wanted to share that this is from the CDC. This has been on the CDC website for a while. Screening testing in sports. Schools may consider requiring screening testing for participation. So again, this is something that the CDC does suggest as an option to help make sports a bit safer. Testing at least once a week is recommended for low to intermediate risk sports. Higher risk sports that cannot be done outdoors or with masks should have testing more frequently. Note that the CDC says that high risk sports, which again would be basketball, some of the things we have playoffs for right now, should not be done at all in areas with high community transmission. And all of Michigan is high transmission. So again, at this time, according to the CDC, there are some sports we just shouldn't be playing. But I just wanted to point this out that testing is not great. Testing certainly has its faults and its flaws, but we also want to make sure we keep our kids in school. So I just wanted to point out that this is something that, and there's a lot more discussion on there from the CDC. So I just wanted to point out there is discussion from the CDC about this. And it is at least keeping kids playing sports that are advised not to play sports right now. So that's just my soapbox right now. We've had quite a few questions this week about, if so-and-so has a positive antibody test, do they have to quarantine? Yes, they do. Antibody testing is not very specific. It can test positive for different coronaviruses on occasion, and we don't know what level of antibodies are necessarily protective. So the only thing that will get you out of quarantine is if you have proof of an actual infection within the last 90 days or you're fully vaccinated. And I've provided 2 references here. So if you have someone who wants to see that in writing, it's here in writing. One is just talking about the limits of antibody testing, and the second is those who need to quarantine, and the exclusions are someone who's had COVID within the last 3 months or those who are fully vaccinated. And I just wrote in there, there's no exclusion for people with positive antibodies. So just so you have that. This slide has been in there this is the 3rd week I've had this slide in here. A little more bold and red.
I need a new case. My phone's so close. Oh, those 2 cases get I just need a new one.
Can everybody make sure their computers or phones are on mute? That would be great. Thanks. So anyway, I'm still hearing comments and confusion about the definition of a close contact due to the CDC saying that students can sit closer together when there's lower risks of illness and they're younger. They did not change, and it has not been changed, the definition of a close contact. This is a copy and paste from the CDC. The definition of a close contact is still someone who is within 6 feet of somebody else. And it specifically says here, for schools who are using less than 6 feet between students and classrooms, so if you have people sitting less than 6 feet apart, the close contact should not change. And I actually took a picture of it today just so you can see I'm not lying. It's right here. So even in my my own child came home yesterday and said they were talking about this in school, how great it was that the close contact definition changed. And I was like, oh goodness, no, it hasn't. So, so again, they have said that younger students can sit closer together. However, if they are, then you're going to have more close contacts. So again, it has not changed. So for a review of our data here, I'm sharing my full desktop, so hopefully you can all see that still fine. So as you can see, the state rates are still going up. They've gone from 366 to 467 cases per million, and percent positivity is 13 to 16.5%. And that's statewide. There's 6 counties in central Michigan on average are at 361 per million. Last week they were 289, and percent positivity went from 11.4 to 14.7. Just kind of looking at our hot spots, some of our smaller counties have had some higher levels. I know Isabella County had some relatively big increases. We had quite a few cases from CMU, which caused their rates to go up pretty quickly, but that seems to be leveling off. The 10 counties in District 10 is at 398 on average. Last week it was 299, and percent positivity has gone from 14.6 to 21.1. So the percent positivity up in those northern Michigan counties is really quite concerning. That can be kind of the warning that rates are going to get higher. So some of these counties are like Missaukee and Crawford, and I think Wexford are struggling with some pretty high case counts. The 3 counties of mid-Michigan are at 414. They were at 329, 330 range, and percent positivity is at 13.5. It was 9.6%. Similar trends. So there's not much more to say about that, and we'll share these numbers out. They're all from the My Start Map .info, so they're ones that you can find. All right, where'd you go? Okay. So this is a map. You have to have special permission to find this map on that website, but I wanted to share it. This kind of zones in a bit closer on geographic areas. This is the state as a whole on the left, and on the right, I zoomed in a bit more on our area. These are cases per 100,000 over the last week. I also looked at it for the last 2 weeks, and it was pretty much the same. I do know the thumb has really been experiencing some major increases. They've been relatively spared until recently. But as you can see, kind of the northern central part of the northern or the lower peninsula have been struggling with some high rates. I'll just kind of leave it there for a second. I know it's hard to see where the cities are, but Mount Pleasant is right here. If you can see my cursor. Muskegon is here. I believe Cadillac was right in this area. Now going over the modeling and data analysis that the state puts out each week. This is just kind of depressing. Michigan has the highest number of cases and the highest case rate right now in the country. Our percent positivity and case rates are up, over 300% since the low in February. Our inpatient bed use has increased. Our hospitalization trends have been increasing. Our ICU utilization is high. Our death count has increased 75%. So at least that's not increasing as much as everything else. But as a reminder, this is kind of the good news. We had done so well for so long. This is the total rates of cases per 100,000 over time compared to the other states in our area, plus New York and Massachusetts. We're the purple line here at the bottom. So we've really been below the curve all along. We're just hitting a steep increase trying to catch up with them, which we don't want to do. But again, we've done a really good job up until now. And that's what we hear sometimes from people is that, well, we don't have much immunity. So we have a lot of people who still need to get sick. Well, again, we don't want them to get immune from illness. We want them to get immune from vaccination. So our goal is that everyone continues to avoid illness and gets vaccinated, which is a much safer way to go. So our positivity trends, you can see we're actually at the highest we've been at since back here in April. We've exceeded positivity rates that we had back in the fall. And as she mentions, that's kind of a warning sign that we'll start to see more cases. Our case rates, again, they just keep going up. This we looked at last time to look at age groups. They changed the colors. Last time red was the youngest, but our youngest age group here again is still not the lowest anymore. And the top 3 age groups are the 20 to 29-year-olds, 30 to 39-year-olds, 40 to 49-year-olds, and then the 10 to 19-year-olds. So 10 to 19-year-olds were leading until just recently. It looks like they've dropped a little bit, whether that's due to spring break or who knows what. Hopefully, though, that trend continues. As you can see, our older population, the 60 and above crowd, continue to not increase as rapidly. And again, we feel that is likely due to their higher vaccination rates. This is why one of the reasons we feel like we're having so much trouble is the large amount of variant that we have in the state. And this is just a drop in the bucket because you have to do a lot of extra special testing to confirm that these are there. The red counties have the B117 variant, which is most common, plus the Brazilian variant. The orange ones have the B117 variant and the South African variant in them. And then the yellow are just the B117. What I did here, this one on the left was last week's map. The one on the right here is this week's map. One, as you can see, it went from 984 to 1,800 in a week. The other is previously, about half of our cases were from the prison system, mainly just one outbreak in a prison. That has not increased very much. So these are really getting to be community spread. And you can see the additional number of counties we've had, and some of these numbers are getting a lot bigger. And again, there's a lot of these that are not diagnosed, but we know when we see spread that's really rapid, really aggressive, and very large numbers involved in an outbreak, you're pretty safe to assume it's a variant. So there's been 81 additional K through 12 outbreaks in this past week. They continue to be the leading one. These blue numbers here, those are the number of kids involved in outbreaks, additional to what was already involved in outbreaks. 53 of the new outbreaks were, I'm sorry, I'm reading the wrong line. So almost 30 of the new outbreaks were in high school students. I'm really not trying to rip on sports, but I just want to share this because I know you probably hear this a lot, and I just want you to have the information. And again, it's not very scientific information, it's just information. There have been numerous clusters, which is just kind of another word for an outbreak that's focused around a specific thing. So numerous clusters and cases around athletics. What I did is I added up the number of clusters and cases. I omitted the ones related just to coaching or staff. So since January, there were 270 sports associated clusters, 995 cases. I went back through all of the weekly reports since the 2nd of January, and there have been 428 school outbreaks and over 1,600 high school students involved. These involve more than just high school students. But again, it's not for statistics, it's not for anything, but just to give an idea that, if there's been 270 sports related clusters or outbreaks and 428 total school outbreaks, just for comparison. And again, just when you get pushback about why we're testing students that are in sports, just to give you some ammunition. So we have a new outbreak in our 19 county, well, my 19 counties, I should say. We have a new one in an elementary school in one of the counties of Mid, one new in junior high in one of the counties of Mid, 3 new in high schools in a county of Central and a county of Mid, and 2 new administration outbreaks. And that actually should be Central and District 10. We have several ongoing outbreaks that add up to quite a large number of students. So we have 15 different ongoing outbreaks. So again, we have seen in this area a similar increase in school outbreaks. The turnaround time for testing is essentially the same as it has been, so testing should not be a limitation to response. This is just a curve of hospitalization. It's getting very close to what it was back in the fall. One thing we talk about when we get to that decision-making algorithm, I guess I'll call it, is just what the public health capacity is. And this kind of helps as a discussion point. We're seeing this in our health departments and also, with the state that helps us with case investigations and contact tracing. Due to the massive increase of cases, we're not able to fully investigate every single case. We are prioritizing the youngest cases, anybody who's school age. So we are doing that. But, again, just like in the fall, when we kind of warned schools that we might not be catching every school-related case, that is the case again. Just to share some good news, we continue to vaccinate more and more people. Over 50% of those that are over 65 are fully vaccinated. Again, with this younger age group being the predominant cause for our increases right now, we're hoping to get more and more of them fully vaccinated. It's a little bit of a harder sell. The age group may not be as eager to get vaccinated, just not maybe feel that it is as urgent to get vaccinated or not be as worried about illness. So we continue to try to encourage that. Oops. I included this slide, this was from that report as well. We do get a lot of questions about, how many people who have been fully vaccinated have gotten COVID. So in the Michigan data, from the beginning of January through the end of March, there have been 246 people who were fully vaccinated and did get infected with COVID. Considering that, we've had millions get vaccinated and it's 95% effective, that is really good, I would say. So we never expect a vaccine to be 100% effective. And again, only 246 breakthrough cases is wonderful. There were 11 that were hospitalized, 3 that died. We really don't know. I don't know anything about those situations. We don't know, if they had comorbidities or, if they had terminal cancer or anything like that. So, but just sharing this information because, again, I know a lot of people are curious about it, but this is being very actively followed, and the CDC will have a website with this data in the future. So this is that school decision-making tool I've been talking about. This is a live link as well, but I shared it in the chat box. This was just something I'd put together to help with decisions about whether or not to be remote. It is not an absolute scoring system. I had said, though, the more no answers you have, the more consideration should go towards going virtual for a period of time. So basically, are you able to follow your safety plan? Are you having, questions about in-school transmission of cases? Questions about the healthcare capacity, like are your staff able to get tested quickly? Are you getting results back quickly? Questions about public health capacity. Like one is, given the current caseloads, are we at the local health department able to identify all school associated cases? And that answer is possibly no. So then if not, are you or your school able to, kind of pick up that slack to an extent? And do you feel confident that you're getting identified or getting notified of all your results? And so on from there. You can add other things that you feel are important. If you feel there's certain pressures from or concerns from other groups, you can add those as well. But again, this was just a decision-making tool that I had put together to try to help kind of think through those steps. But I just want to remind you that that was there. I'd encourage you, as much as you feel able to, encourage your staff and your students that are over 16 to get vaccinated. There is a toolkit with information you can use with your employees. And there's also information on the state website. And there's numerous, you can go to our website, you can go to a federal website, you can go to state website, or for those who don't have internet, they can call a hotline to find an appointment to get vaccinated. For those staff that you have that may be concerned about school being open right now, if they're not vaccinated, perhaps encourage that. I know it's sometimes a difficult conversation. All right, so that is the end of my slides at this point. I will find my first question here. Looks like we have a few. Okay. So MDHHS guidance on student athlete testing doesn't appear to reference close contact tracing for rapid test results yet. We've been contact tracing for rapid tests for the average student employee prior to this. So I think I clarified that with that algorithm that, again, if they're really low risk, no symptoms, no exposures, you wait until they get the confirmatory test done and the results back before you contact trace. The exception to that would be if they refuse to get a PCR test, they don't plan to get one done, or if it's going to take them more than 48 hours to get it done, then you would go ahead and say, we're going to have to assume you're positive and then do your contact tracing then. Next one. A school just emailed me regarding graduation on May 28th and wanted guidance capacity. The event is outdoors. So it's the same as is in the executive, or not executive anymore, the epidemic order. I want to say it's 1,000. I'd have to go back and reread it. But if they go to the epidemic order and the FAQs associated with it, the guidance is there. And I know the FAQs have some specific scenarios that are like that. Please advise, should a prom even be considered due to current numbers outside event? So anytime people gather together, there's a risk. The closer people are, the more the risk. The state had continued to say they were going to come out with some kind of guidance for prom, and I haven't heard anything further than that, so I'm not holding my breath. My concerns with prom are two things. One, people often eat and drink at a prom, not always, but that's a risk. Second is, I don't know how kids can not maintain a 6 feet or more distance radius at a prom. I know that the counter argument to that is if you don't allow it and allow it in a way that is safest, they're just going to do it underground and unsafe. So there's no perfect answer to that. I think if the concern is that if you don't allow one, that they're going to do it on their own and not safe, it's probably better to work with them to schedule something. But again, it's got to is best, and as much distancing as possible, masking, no food, that kind of thing. So, and the other thing we've seen with parties like that is kids that are sick or that have been positive or have been exposed go anyways because they don't want to miss it. And so there's got to be some kind of a catch safe or some way to really try to screen those kids or make sure you know who should not be there. I know this is all really difficult. Who is responsible for getting COVID tests to non-school affiliated athletics? Those programs are. So there is a place on the website for those clubs and groups to sign up. So it's their responsibility, from what I understand. Can you clarify what the stipulation is for schools to receive funding?
This isn't a question. It was just sharing some information that I received from my legislator's office this afternoon.
Oh, the
20-hour requirement. Basically, if you get to the third point on that, the aide in the office is saying essentially, or that she got this from the policy office, that it's unlikely that districts will lose funding if we have to go remote or have less than 20 hours of in-person instruction.
Awesome. Yeah, I was just talking about that with one of my health officers this morning about how I don't want to say absurd, that might not be a great word, but
no, I think it's a good word.
Yeah, it just wasn't the best thing. And so I'm glad to hear that, they've kind of realized that that wasn't the most practical thing. And, that you're kind of being forced to choose between safety and finance. So, well, good. So that, for anyone who's on the call, he copied and pasted that information into the chat. And I'm sure, that'll likely make it through everybody's email chain from the higher ups as that gets to be more official. So thanks for sharing that. The next one is, there are rumors of another shutdown. Is there any credence to these rumors? I have not heard anything. And I've heard some things to the opposite, saying that there are no plans for that. If any of my health officers or anyone on the line have heard anything, they can chime in. But I think at this point, none of us have really heard anything about that, despite the situation.
Well, this is Marcus. So we talked to the governor's office yesterday, and at that time, they said they had there was nothing, on their plates indicating a planned shutdown. And then we will be talking to MDHHS tomorrow. Obviously, as things get worse and worse, you have to worry that what was true yesterday will not be true tomorrow. So we'll just have to watch it.
Yeah, I think my one other comment is that we typically don't know things until you know them too, as like the announcement on Monday. So we'll all learn about things together. The next question, do we need to do sports testing for students who are 2 weeks past their second dose of vaccine? Yes, you do, because as I just talked about, those that have gotten infected despite vaccination, people can still get infected even though they're fully vaccinated. It is rare. And those individuals were symptomatic. And so, we're still learning how much asymptomatic infection can happen after vaccination. So again, you'd still confirm it with PCR, because when you have a low probability of illness, sometimes those are falsely positive. So even though that would be a motivator, they still need to get tested. The big motivator is if they're exposed to a teammate or anyone else, they do not need to quarantine. So if they are fully vaccinated, they don't have to miss anything if they're exposed to someone else who is positive. So there is some motivation there. Does domestic travel include Hawaii? Yes. So it's any of the 50 states and territories, which I noticed when I was updating my handout, and I told my husband we should go to Puerto Rico, but that's kind of a dream. So, but yeah, that's technically the definition per the CDC. If a parent has a positive test and students are in the home with them, when does the clock start for the student? Does it start when the parent tests positive, 10 days, or after the parent has tested positive? So it starts from the last day they were exposed to the person who's contagious. So if I found out today that I have COVID, and I stay in my bedroom, use my own bathroom, I'm not around my kids at all, their first day of quarantine would officially be tomorrow. If I found out I was infected and I didn't do anything to try to stay separate from my kids, and let's say I'm asymptomatic and I was tested today, my kids' quarantine would start 10 days from today. If my symptoms started today, then their quarantine would start 10 days from today. So it really matters. If you have a parent who can isolate away from their family, which a lot of families do have homes where they can do that, then it starts the day following when they're able to be separated. I hope that makes sense. We have received some questions about whether or not our spectators have to wear masks at outdoor events. Yes, they do. So do spectators have to wear masks if they are socially distanced with family members and are outside? So according to the epidemic order, masks must be worn at all gatherings. It's not inside or outside, it's just all gatherings. If so, is there a medical exemption for individuals? So yes, one of the exemptions, and so, it's whenever there's questions, that epidemic order is a good place to go back to, and the FAQs are a good place to go back to. One of the exemptions is if there's a medical contraindication and they don't have to provide written, like a doctor's note or anything, they just have to tell you that they can't wear one for medical reasons. So, and that's all specified on in the orders. Still 10-day isolation from symptoms for positive case or 10 from test. Yes, so isolation timeline has not changed, just the quarantine timeline. A study just came out showing that the new variant might actually make you sick and contagious longer. So hopefully it stays 10 days, but yeah, for now it's still 10 days for sick people to stay in isolation. So if no symptoms, but quick test says positive, we send the athlete for PCR, and only if that is positive, we quarantine and contact trace. Correct. So the close contacts can still go to school practice while we wait for PCR. Correct. That's assuming, none of them are positive, and all their tests were negative and everything. And just to clarify, when you say, wait for the PCR to quarantine and contact trace, that's for the close contacts. The positive athlete should go in isolation and stay home until their PCR test comes back. So they need to isolate away just in case. Schools are only required to report positives from athletic screening. Is there a way to report to the state an aggregate count on the negative test? So you are supposed to report all positives, and once a day or once every 24 hours, you are supposed to report an aggregate negative count. So that is what is supposed to be happening. When I asked them, how is that supposed to be happening? They said that the website would be updated on the 10th. So, because that rule just changed, I want to say the end of last week. If any of my CD nurses are on the line, if you know how they're supposed to be reporting that aggregate negative count, you could let us know. But with communicating with the state testing program, they said that they were updating the online reporting system so that you could report that aggregate count, but it's not ready yet.
Dr. Morse?
Yeah.
The advice that we were given is that we are given a sample form, and I think that's what I attached there. You're supposed to use the same form that you use for the positives, which are done on an individual basis, but all the negatives are filled out using a template on that exact same form with a total number that are on there.
Okay. And I'm trying to find where I was in my questions. Okay, so I think it was Jen. So if you still have any questions about reporting, you can contact your communicable disease nurse at your county health department, or you can email me and we'll make sure you get things situated. We were informed that the 15 minutes for close contacts in quarantine is no longer correct due to the new variant. Is this correct? No, it's not. It's still the same. It's still within 6 feet for 15 minutes or more. So I don't know who told you that, but it's all the same right now. I've been told that if someone was positive, they will continue to test positive for a length of time. Therefore, if an athlete tests positive and does their 14-day quarantine, when they return to school and get tested for their sports, they'll be positive. So the PCR test that tests for the genetic material can stay positive for months. The antigen test usually is only positive for about 7 days. However, if you have a student who has tested positive within 90 days and they can provide record of that, they do not need to be tested again. So if they don't, like if they were diagnosed a month ago, they need to get and that I know is in the instructions. They need to get a note from their doctor. If their doctor won't do it, have them call us and we can provide record. Just given our situations, it might take us a day or two. But again, there is instructions in there that says if they can, provide documentation from their provider that they had a diagnostic test and illness within the last 3 months, they do not need to be tested. So that should be a non-issue for this. And again, the antigen testing doesn't tend to be persistently positive. what do you suggest to encourage vaccination? Concerned about those who are reluctant. Is there a debunking the myths resource you can share? So the website immunize.org has different tabs on there. The tab on the furthest to the right at the top has a lot of resources for the public. Really what they're finding is the biggest motivator. Well, there's two. One is their healthcare provider's recommendation, but the other is hearing from their peers or people they trust, hearing that they got vaccinated and hearing them encourage it, that kind of thing. For us to say, oh, the science shows it's best you get vaccinated, we're not often trusted. We're kind of, big government, and it's more important if you had one of your high school students get vaccinated and then, promote it throughout the school, or if your teachers promoted it or just talked about it, not necessarily told kids to go get vaccinated, but just talked about it, or posted pictures of them with their Band-Aids or things like that. So that tends to be one of the best ways, is just to promote that, people like them are getting vaccinated. I know it's difficult right now. According to your algorithm, we do not have to send for a PCR test if they were exposed to someone with COVID and test positive with the antigen test. However, we are told to send them to get a PCR test if they do positive. I know. And that's what I was mentioning, that there are places, and I know the Michigan High School Athletic Association takes verbiage from the state. So there are two spots in the state's materials that say anyone with a positive should get PCR tested. And I've addressed that with the state, and they're working to clarify it. So you do whatever you're comfortable with. And again, they're working to clarify it. So medically speaking, they shouldn't need a PCR test. But again, the issue is if, they've been exposed and they have a positive antigen and a negative PCR, are you comfortable saying that they're fine? So if they've been exposed, they should be in quarantine anyways. But long story short, the state's working to clarify those discrepancies. I know we're running short on time. Use of playground equipment such as balls allowable. It's the same as it's always been, which has been, I'm trying to remember now because that goes back so long. Minimize shared equipment. And then if shared equipment is used, clean it between uses. So ideally try to have, one ball per kid, but obviously kids are going to share. So the biggest thing, transmission from objects is really minimal. So the best thing is clean the ball between recesses and have the kids wash their hands or use hand sanitizer after recess. And really the risk is quite low. When does the vaccination move from experimental to an actual FDA approved vaccination? Good question. I don't have the answer to that. I do know I'm frustrated because all the tests we're using are still emergency use authorization, and I wonder when are they actually going to be approved. So I don't actually know when that switch gets flipped, or what they need to do to have full approval, or what they call emergency use authorization. So I'd have to read up on the FDA rules for that. Staff members have said that they are told to quarantine for up to 24 days from the health department. Can you explain the reasoning behind this? So most of our contact tracing, most of our follow-up with our close contacts is done by the state. And again, we've had some very recent issues with some of them giving wrong information, and we are working on that. I think they're people that have been newly hired. The 24 days would be if the child or someone was not able to isolate away from the infected individual, as I kind of described before. So you'd have to isolate from the last day you were exposed. So it'd be the 10 days while they're infectious, and then your 14-day clock would start. So it's 24 days. We've heard some comments that everyone was being told 24 days, regardless of whether or not they could isolate apart. And we've been talking to the state about that. So hopefully it's been rectified. But so we see it often, like if it's a 2-year-old, mom's sick and it's a 2-year-old, the 2-year-old has to be in quarantine for 24 days because mom can't stay away from a 2-year-old. Can somebody who is fully vaccinated or had the virus within 90 days be a carrier of the virus? The vaccine, no. The vaccines do not have any whole virus, contagious virus, nothing like that. So unless you were to get infected with the virus, there's no way the vaccine itself would make you contagious. Once you've been infected, pretty much after 8 days, people stop shedding viable virus on average. It can go longer in some. With the variant, it can go longer, more towards 10 days or even 13. They're still researching that. People with a bad immune system, like if they're on chemo or different things, it could be longer, like a week or two. But after that, you don't shed live virus anymore. You may still test positive for dead virus. So that's where you get that persistently positive test. But they've done tons and tons of studies where they culture the virus and there's no living virus anymore. It's just your cells still have dead virus in it. So when you test for the RNA, it's still there. Will a person who recently had a positive COVID test with symptoms and is now required to test again for a medical procedure test positive again? So yeah, like I just said, that PCR test can stay positive for quite a while, and we've run into that issue with people trying to have surgeries and things. If it's within 3 months and they have no symptoms, we do not consider them a new case. We do not contact trace again. That was part of that question. Is the quarantine different for those who tested positive versus those that are a close contact? So if you're positive, you go into isolation, which is 10 days. If you're a close contact, you go into quarantine, which is 14 days. What can an employer do if a staff member is fully vaccinated, has tested negative, and yet still has COVID symptoms? Should we require quarantine or assume it's another issue? So there is Public Act, what was it? Public Act 339 states that you can't return back to work unless you have a negative test, or you finished out your isolation, or you've improved, or some different things. So if, according to that, if you've tested negative, per the state law, they are able to return to work. Governor Whitmer has recently quoted in the news article stating that she has no intentions of reinstating any restrictions. Yeah, that's kind of the impression we get as well. And then there's a link for the instructions on how to report the negatives in the chat. Thank you. Does an athlete who tested positive need to quarantine for 14 days, or are they only contagious for 10 days? So again, someone who's positive, I know this is semantics. When you're sick or positive, you isolate for 10 days. When you're exposed, you quarantine for 14 days because that's how long it can take for the virus to incubate and show its ugly head. So an athlete who is positive would isolate for 10 days. Where on your website do non-school sports register for COVID tests? We don't have it on our website. It's on the state website. If you go to michigan.gov/ if you go to the michigan.gov/coronavirus, on the top, there's a tab that says resources. If you click it, there's one that says like schools and testing or something like that. That's how I always get there. Oh, and then Melissa put the link there. So it's in the chat box from Melissa. Thank you, Melissa. All right. Whew. 2 o'clock on the button. Anybody?
I had one question in regards
yeah.
to, I'll make it quick. It's just referring back to the question is if somebody can be a carrier. So my question was, if somebody has had the vaccine, obviously they're not going to be a carrier, but what if they are in a group of people, have been exposed, but they're not going to get it because they've had the vaccine? Can they carry that, whatever they were exposed to others who have a low immune system? And I'm asking this because we have some staff members that work with low immune systems, but they have thankfully gotten their vaccine. That was my question. And
yes. So that's the concern, and that's why, you know, the CDC says if you gather with someone who's not vaccinated, you should still wear a mask if they have high risks for complications, because it is possible. And, you know, all these studies are still going on to see how possible, but theoretically you could get infected and you could, you know, be asymptomatic and shed virus. The odds of that are really, really low, but if you're with people who are high risk for complications, happen, you should still always wear a mask in public places. And by Michigan law, you have to still wear a mask at work and in public places. But that's why that recommendation is still there from the CDC, that if you gather with someone who's not vaccinated, you should still wear a mask if they're at high risk for complications.
okay.
Because
that would probably be the same with those who have already had COVID. It's within like the 30 to 60 days, and we're not requiring them to quarantine because they've already had COVID. We have positive test results to show that they have COVID. They don't have any symptoms, but if they were exposed, we're not requiring them to quarantine because we don't have to have them required to quarantine because they've had the virus. They could then also be carriers to somebody that has a low immune system.
right. And the risk of infection is like 1 in a million, but I mean, in theory, it could happen, but that's why, you know, you wear your mask, you wash your hands. And if the caveat is always, if they have any symptoms at all, they're out of there. You know,
sure. And we are definitely, we're making that known. Any symptoms, you're in quarantine. But we just wanted to we're still being very cautious, especially with the students that we have. We just want to be, so we just wanted to clarify that to make sure that our intake was wrong, but it is in line with what you're saying.
Yep. No, it sounds like you're doing everything right.
Thank you so much.
Yep. And it looks like one more comment or question. There are studies that say only 1 vaccine dose is needed to give immunity to a person who has previously had the COVID virus, and that immunity is even greater. May a person who has had the virus and will now receive a 2-part vaccination receive just 1 dose? So those studies are not huge, and we don't really have very long-term data on that. And so you would not be considered fully vaccinated, and we do not recommend that you only get 1 dose if you've had COVID before. So again, even if you've had COVID, get your full vaccine series. Oh. Any other questions? You can unmute yourself if you want to, or anything else. All right.
Dr. Morse,
Yeah.
This is Chris Griffin that I spoke with you right before 1. I did email you again and only asked if we could get like an updated letter for that particular employee with the correct dates or an email or something, because they're not happy with that.
Okay.
Okay.
Yep, I'll work it out.
All right. Thank you so much.
Yep, no problem. Well, I know these last few weeks have not been the easiest for all of us. We want to be here to support you in whatever you guys need to do. I know we didn't talk about it much, but we don't have plans to tell you you have to shut down. We want you to work through those decision-making tools, and whatever you need from us to help make those decisions, let us know. But we really think it's a school by school decision on what's best for you and your community and your kids. So hang in there and let us know if we can do anything. Talk to you next week.